Good afternoon and happy Sabbath to Capital City family and friends. I am Dr. Avonelle Dorant, and I am just going to be presenting a few important reminders concerning COVID-19. So we're still in the middle of this pandemic. It's been 3 years now. And even though we're now dealing with the Omicron variant, and we have been seeing that there are a lot milder infections than previous variants, it is still very troublesome. The United States has surpassed 800,000. I think they reached about 861,000, around that, approximately that amount of deaths in the last few days. And our people, Black Americans, have been disproportionately affected by this pandemic. So African Americans make up or compose about 13% of the population, the US population, but we have experienced 23% of deaths during this pandemic. So we must continue to do everything that we can as a people and as a church to keep ourselves safe and to take all precautions that are out there and are recommended. Now, the CDC recently updated its mask mandate or its mask recommendation. And I mentioned this 2 weeks ago when I did the presentation. They're requesting that we use a well-fitted mask, preferably a NIOSH approved mask. The best one, of course, is the N95. And if you're having to travel, for sure, that's what you want to be able to use. It offers the most protection against COVID-19. Any mask is better than none at all. But whatever mask you choose, we want to make sure that it's well-fitted over your mouth and nose, and it's comfortable to wear, and that you're wearing it consistently and correctly. Many of you also have or have had experiences with COVID in the home. 1 or 2 people maybe got infected, but not everyone. And so there are some things that are very important for you to remember as far as trying to keep yourself safe. Making sure that you wash your hands very frequently, especially if you have someone that has COVID in the home. And then it's very important that you don't touch your face, and you need to clean all high-touch surfaces in your home pretty regularly. And these would include like door knobs, fridge handles, microwave buttons, light switches, hardware that's used to turn on and off faucets of water faucets. If you're having to share a restroom or a bathroom, you want to make sure that you're cleaning off also the toilet levers and any banister rails that you have in your home, that you're wiping those as well. Any personal items that you're using, this is whether or not you have someone that has COVID in the home. Make sure that you're cleaning your cell phones regularly and your headphones as well pretty regularly. We reviewed a couple of medications that I think everyone needs to be thinking about during this time, especially making sure that your vitamin D levels are normal, or at least on the high side of normal. So making sure you're taking vitamin D3, 4,000, 5,000 international units per day is probably not even going to be an overdose. That should probably be what you're taking, what I would recommend. And zinc, 40 to 50 milligrams every day. We reviewed the importance of zinc in terms of preventing the virus from actually being able to attach to surfaces in your oropharynx or nasopharynx. And then the other thing that's really important that I just want to emphasize again is the importance of gargling. So the importance of gargles. I add hydrogen peroxide to my my mouthwash, and you can also use Listerine. Listerine is very effective as well against the virus. And then if you are able to, as you're able to get a hold of povidone iodine, this is something that's very potent. It definitely, the virus, especially the COVID-19 virus, is susceptible to iodine. And you want to put a few drops of the iodine into your mouthwash and gargle for 30 seconds, 45 seconds if you can, at least once, if not twice a day. If you actually do have, or if you've been exposed, or you think you've been exposed to it, or you are diagnosed positive with COVID, then you ought to be steaming as well using essential oils. They're very good. There's several good ones that I can recommend. The red thyme oil, black seed oil, rosemary, and there's one called thieves oil, and that is a combination of clove and rosemary, and it has some eucalyptus, and there might be another one in there as well. And these are very potent oils that will help to decrease the viral load, as well as the steaming. And then another very important over-the-counter medication that everyone needs to be on if you are diagnosed with COVID, if you test positive, is aspirin. Not just the baby aspirin, but you should put yourself on a full 325 for adults of aspirin, 325 milligrams. Aspirin has been associated, these are studies that have confirmed that aspirin has been associated with a 44% decrease risk for ending up on mechanical ventilation, 43% reduced risk for ICU admissions, 47% decrease in hospital mortality. And the reasons are that aspirin is a anti-inflammatory, as well as it has anticoagulant properties. It's a blood thinner, in other words. And it has a very highly impressive safety profile. We know that COVID causes the body to form clots. You make clots throughout. You may make microclots in the lungs and clots throughout the blood vessels as well. And also the brain. So many individuals succumb after experiencing strokes. And the strokes are from the clots that are forming in the brain. And so aspirin decreases clot formation and inflammation, and that's why it's so effective. So definitely, if you've been diagnosed with COVID, if you've tested positive for COVID, get on aspirin as soon as possible and take it for like a good 2 weeks until you have completely cleared the virus as well. The pace of COVID-19 deaths continues to rise and probably will rise over the coming weeks. We know that deaths will lag infections by a few weeks, and because we're still recovering from the surge of infections that happened over the Christmas and New Year's holidays, so you can expect to see that you'll have deaths continuing to rise for a couple of weeks. Just a word on vaccinations. Now, there's a lot of debate and discussion about the COVID-19 vaccines. And like I have said before, the vaccines are not benign. People are having problems with the vaccines. Everyone has to weigh their risk benefit, and make a decision for themselves. What I can tell you is that the COVID-19 vaccines, including the booster shots, especially the mRNA vaccines, they're not blocking the breakthrough of infections. In other words, you probably know someone who's been vaccinated who has gotten the infection. We know that several people who are vaccinated, several people who are not vaccinated also are getting infected. So it's not blocking actually getting an infection, but what we are actually seeing is that these infections that you get for the vaccinated, they're mild to moderate symptoms. So although the vaccines do not prevent breakthrough infections, and we were hoping and we thought and we kind of were led to believe that they would do that initially, but we are still coming down with infections. However, they are working to prevent serious illness and death. So the vaccines there's still a very important role that the vaccines are playing. And this is consistently what we are seeing in terms of what the hospitals are reporting. A lot of the patients that are now in hospitals, and the hospitals are still full, they're unvaccinated. So the unvaccinated are the ones who are ending up in the hospitals or in the ICU for the most part. Unvaccinated are experiencing more severe infections, even from the Omicron variant, which is relatively mild especially for the vaccinated. So the bottom line is that if you're vulnerable, if you have a lot of comorbidities, or if you are senior, above 65 years old, you are still at significant risk, especially if you are unvaccinated. So I just want to encourage everyone to continue to be vigilant. Take precautions to protect yourself and to protect your family. Don't take any unnecessary risk. Continue to wear your mask. Continue to social distance, because the virus needs proximity in order for you to catch it or for you to spread it as well. So as far as you can, this is still a time to stay home as much as you can and protect yourselves. So I want to say to everybody, be safe, stay safe, be well, and God bless you.